core audience of investors and funders, national policy partners in birth and grassroots social service and well-being organizations. Next slide. So as I mentioned in the purpose, today's webinar is geared towards community leaders who are a part of the Birth Equity Leadership Academy, and particularly participants who are recipients of the BELA Community Demonstration Project Awards. HealthConnect 1 is supporting these individuals who are dispersed across the country. And the purpose of this project is to provide technical support and financial assistance for BELA leaders initiatives and their projects. Some of these projects may be brand new projects and some may be existing projects in underserved communities and in communities of color. So while this webinar has a specific purpose, I'm hoping that the information that we're sharing today will benefit not only all BELA leaders and mentors, but as well as individuals who are interested in grounding in both evaluation and community organizing and how these two can be used together to advance social justice and birth equity. Also, this webinar assumes that today's participants have a basic understanding of the subject matter, which is evaluation and community organizing. Next slide. So what is evaluation? Evaluation is a very expansive field, and the definitions that you're seeing on your screen right now are from Michael Quinn Patton, who is an independent organizational development and program evaluation consultant. He's also a former president of the American Evaluation Association, and he's also the founder of Utilization-Focused Evaluation. So the definition of evaluation is a process that critically examines a program, a service, a policy, or a strategy. It analyzes information collected about a program's activities, the program's characteristics, and the outcomes. And it also makes judgments about a program to inform decision-making. Typically, you'll hear the phrase program evaluation, but as I mentioned, you can evaluate a program, a service, a campaign, or a strategy. So for the purpose of the webinar today, I'll either be going interchangeably between evaluation and program evaluation, but I just wanted to make that clear. So as you start learning more about evaluation, you'll often see, as I mentioned, that evaluation and program evaluation tends to be used interchangeably. And also the image that you're seeing on your screen right now is from the Aurora Consulting, which is a consulting evaluation firm that's based in Minneapolis. And what I like about this image is that it not only depicts the evaluation process, but it's also a clear demonstration of what evaluation is centered on. And it's centered on learning and also course correcting where needed. It's also showing us that evaluation is an ongoing process, and that's something that I try to instill in my evaluation clients, regardless of their reasoning for conducting an evaluation, which we'll get into in a few minutes. The first step is question, and that's developing a series of questions that will focus and provide structure to an evaluation. This guides the evaluation planning process, including how you gather your data and the methods that can be used to obtain the information that is important to the person who is implementing the project. And also that includes various stakeholders such as staff, the recipients of the program or the service, funders, policymakers, and various types of stakeholders. The second step, which is investigate, which involves implementing a series of evaluation activities that are used to collect data. The third step, which is reflection, and that includes combing through the data that you'll be collecting during your process to identify any types of emerging themes that are based on how the recipients of your project are engaging with your program, your service, and your strategy. And the final step, which is improve, and that takes the emerging themes that you've identified in the reflection process or the reflection step to suggest ways that you, if you need to course correct where needed. But as I've mentioned, approved isn't the final step of this process, as it does encourage for evaluation to be an ongoing process as part of your program's implementation and monitoring. Next slide. So there are various reasons why someone may want to do an evaluation, and these are the top 2 reasons. So to evaluate, you want to conduct an evaluation in order to improve a program design or the implementation, and this is to improve the effectiveness of your program. It is important to periodically assess and adapt your activities to ensure that they are as effective as they can be for your project and program participants. And with evaluation, I find that organizations and individuals who are doing evaluation, they're able to identify the different areas for improvement and be able to course correct where needed. The second reason is to demonstrate the impact of your project or your program. And what evaluation is able to do is demonstrate the success or the progress of your program or your project, and it allows for you to communicate how that impact is impacting the recipients of your program or service, which is crucial for obtaining and attracting different types of support. That could be support from different funders, and it could be different support from like-minded organizations or individuals who want to get more involved with your cause. And it also helps to gain some buy-in from not only potential funders, but also from staff as well, because staff really enjoy learning and seeing and understanding how a program or a project is being implemented, and also staff work really hard with their programs and their presentations, and it's also really nice to see that what you're doing is really resonating with your audience. Next slide. So there are a variety of evaluation approaches and theories. I'm not going to get into all of them today, but what I will do is say that the majority of the evaluation theories tend to fall into 3 distinct categories. And the first one is use, which is conducting an evaluation that assists key program stakeholders in program decision making. Methods are concerned with the use of social science research to make statements about reality, and valuing is the last one, which makes evaluation pretty distinctive from just regular research, and it focuses more on the evaluator, and it places value on their research findings. With my past and current evaluation clients, I've noticed some themes connected to how they relate to the evaluation process and just the overall evaluation goals. And they tend to be more social justice driven, and they provide programs and services to traditionally marginalized groups. They want to know what they're doing is resonating and gaining insight into how those things are working. They benefit more from an evaluation process that's more collaborative and participatory, as opposed to having someone come in and do the evaluation for them. So they're working with an evaluator or an evaluation team, as opposed to having this person take charge over the entire process. And lastly, they're more likely to utilize the findings if they understand the evaluation process and they feel a sense of ownership about the process and also about the findings. And so because of this, I find that a lot of organizations and individuals that tend to be more social justice minded tend to fall under the use category, and sometimes under the valuing category, because there is an emphasis on social justice. Next slide. So the goals of the BELA projects are to support the community demonstration projects from our BELA leaders across the country, to provide financial assistance and technical support for the initiatives and the projects that are being led by the BELA leaders, and to foster collaboration, share learnings, and support new or current work that's currently taking places in underserved communities and communities of color. And so because of that, BELA participants can benefit from the evaluation process that is more culturally responsive, participatory, and has a greater focus on how to use those findings as a strategy for program improvement and to better inform their work. And within the context of the BELA project's goals, which are on organizing, movement building, and communications, I've identified these 4 evaluation methods. So the first one is culturally responsive evaluation. And this is an evaluation process that examines the impact of a program or a project through the lens of the culture of the participants. The culture of the participants is considered a very important factor, and that can impact how participants engage with your project, but also how you engage with your participants as well. I find that with CRE, which is short for culturally responsive evaluation, there's more of an emphasis on self-awareness, and not only of the participants of your project, but also of you yourself. So just to give an example, I identify as a Black American woman. However, even if I go into a space where the majority of the participants are Black women, because we share that commonality, there may be things that I can engage and connect with them with. But because, and we'll talk a little bit more about this later on in the presentation, but because I'm coming in with a particular level of expertise, that may present a barrier in how I engage with program participants, because there's a lot of questioning and unsureness about just researchers and evaluators in general coming into marginalized communities, and just a lot of history around that, and how oftentimes we, as individuals or communities or as organizations, rather, we go into communities to collect different types of data, but we never go back and hold ourselves accountable to sharing that information back with the community. And so with CRE, that is a part of that process. The second one is participatory evaluation. And it's a process that allows stakeholders to come in at various levels of engagement to work together to choose a research or evaluation design, collect data, and to report on those findings. The third one is utilization focused evaluation, and that is a process that facilitates decision-making among people who will use the findings of the evaluation. And this one is key because it helps for individuals and organizations who do have a history of collecting data, either through a survey or a focus group or things like that. But sometimes they may just sit on that data, or they don't know how to share that information with their different stakeholders, and that includes participants. And the last one is empowerment evaluation, which I feel encompasses all 3 of the former evaluation theories, in that it empowers individuals to take ownership of the evaluation process. So it empowers participants to become more invested into the program, and it also empowers individuals and organizations who are conducting evaluations to actually lead this process themselves. Some of the evaluation questions that we have for the demonstration projects are: how can HealthConnect One support leaders with evaluation? What is the framework that the organization will provide for evaluation? How can HealthConnect One co-create tools with leaders that can be adopted for future use? And how can the organization create an evaluation process that is not overbearing, but does capture information, addresses learning barriers and challenges, and also assists the awardees in their project endeavors? Next slide. And so, in other words, the question is this program operating in the way that it was intended? There are a variety of reasons why a program, service, campaign, or strategy is being created, just as there are lots of reasons why an evaluation is being commissioned. This can include various different types of social and behavioral theories, feedback from past participants. You may have a funder that is requesting for you to create a certain type of program or evaluation. Different policies in your city or your region or your state may impact how you develop a program or a service, and also current events that are happening. with a program, while a program is designed with a particular goal in mind, it's important to understand that how we envision a program operating may not be how participants ultimately engage with it. So this isn't considered a bad thing. Rather, it's just a part of the learning experience. And this goes back to the previous slide about the 4-step evaluation process, where we're constantly questioning, investigating, reflecting, and improving. And so ultimately the evaluation focus for the BELA demonstration projects will be, how can we tell the stories of our participants who are engaging with our projects, while also being responsible for reporting back to HealthConnect. Next slide. So how and when to evaluate? When you evaluate really depends on the length of your program. And I do believe for the demonstration projects, the projects and the final reporting will be due from a year from now. So you have about a year to implement your program. And there's various ways to collect data. And we're gonna go into the three main types. The first type is quantitative, and that's basically gathering numerical data or data that can be transformed into usable statistics. And typically with quantitative data collection, you may see someone creating and administering a survey or a questionnaire, for example. So those tend to be the default sometimes when it comes to getting quantitative data. The second one is qualitative data. Which is focusing on uncovering trends and thoughts and opinions, and it goes a little bit deeper into the topic. And so oftentimes when people do qualitative data collection, they're doing it by way of either observation, where they go in and they observe how participants are engaging with a program or a service. They may do a focus group where they have individuals who are part of that project who have similar characteristics, and you bring them in and you ask them questions based on how they are engaging with the program or the service. And the third one is informant interviews, and that's more one-on-one when you're engaging with not only program participants, but also different types of key stakeholders. The last one is mixed methods, and that's just a combination of both quantitative and qualitative data collection. Depending on the length of your program and the life of your project, you can decide which one is more of a priority. Sometimes that may be getting more surveys out, or sometimes that may be if you have more time to sit and work with a focus group and also translate that data, you may choose qualitative. But for my clients, we tend to do a mixture of both. And a lot of that depends on the length of time that we have with the evaluation process. So there's a variety of factors that can impact how and when someone or organization does an evaluation. Budget tends to be the main thing. Sometimes you may have a lot of money geared towards a particular project, but you may have a certain amount of money that's geared towards the evaluation of that project. So budget is always a major factor. As I mentioned, time constraints can be a big thing. If you have, such as with the overall BELA project, we have a 3-year project, 3 years to gather and collect data and report back on it. But for our demonstration projects, you have about a year to do your presentations you do your projects and you collect your data depending on the length of time. The setup of the project. If you have a project that allows for you to engage with participants on a very routine basis, you have more opportunities to collect data from them, versus if you're doing for example, a workshop that's a part of your demonstration project. You may feel that you have that one time to get data from your participants. Individual staff and volunteer capacity is a major factor in how people develop a project and also conduct evaluations. If you feel that you don't have a lot of staff or volunteer support, it may impact how extensive or how drawn out your evaluation project is. Assumptions about recipients. Depending on the focus of your project, you may have recipients that speak a certain language. You may have recipients who live in a particular area. And that can also impact how you conduct and gather your data. If you have someone or a group of individuals that live in a rural area, you will have to think a little bit more about whether or not you can actually go to that group versus if they have transportation to come to you. So that's another thing to keep in mind. And also requests of funders. That is also a major factor in how people design their projects and also how they go about evaluating their projects. Sometimes a funder will let you know what it is that they want you to investigate. And some funders may give you free rein to identify what your goals are. So that's always something to consider as well. Next slide. And so because budgets tend to be a major factor in how we develop our projects and also how we do our data collection analysis, I wanted to share some free or low cost evaluation tool resources for you. For data collection, some of the tools that my clients are very comfortable with for quantitative purposes, they like to use Google Forms. It's free. Most people tend to be really useful or understand the Google ecosystem. And so they're able to navigate the different types of Google Drive, Google Forms, Google Slides, Google Spreadsheets, and things like that. The last three, depending on your overall needs as an individual or as an organization, you may have to pay a little bit of money for. SurveyMonkey, Typeform, and Poll Everywhere. Typeform and SurveyMonkey essentially are the same thing. You can create a survey within those systems, and depending on how much you pay for that service, you're able to collect your data and analyze your data in that way. Poll Everywhere is more of a collaborative tool where you can use this when you're engaging with participants or with an audience. So for example, people, and we're assuming that people are all have cell phones. And so you will have to type in a particular code to go and participate in Poll Everywhere. And you as a facilitator or presenter can share your question on a screen, and people can share their responses in a text, and you will see their responses populate in real time. And not only is that a really good way to collect data, it's also a really good way to share data as well, which I'll get into in a few seconds. For data collection and qualitative data, for your focus groups and your key informant interviews, you can utilize Skype, Google Hangouts, Zoom, or Ring Central. And also depending on your needs of your individual and your organization and your project, you may or may not have to pay. And also free conference calling in Google Voice. Those are very good for recording conversations, particularly when you're collecting qualitative data for interview and focus group purposes. Sharing data. Some of my favorite tools are Canva. Canva is essentially a free tool where you can create different types of graphics. You can create an infographics as well in it, and you can also share those graphics on social media. And it's a really good way to align and also to develop your images based on the specifications of different types of, for example, social media. With Twitter, your picture looks a particular way versus how it looks on Instagram or on Facebook. And so Canva has that mechanism to help you to design your image within the specifications of the different social networks. PictoChart is similar to Canva, but it focuses specifically on infographics, and I believe that that is about $35 a month, depending on what your needs are. You have the standard PowerPoint, Keynote, Google Slides, Word pages, and Google Docs. These are useful in creating different types of evaluation reports and also presentations for your audiences. And the last two are from an evaluator and a data visualization specialist called Ann-K Emery. And she, along with Stephanie Evergreen, have created the Interactive Chart Chooser. And this is a really great resource. If you just do a Google search for interactive chart chooser and Kay Emery, it'll take you to her website, and you're able to see a list of different types of graphs that you could use to share your data in presentations and in reports. So I find it to be very user friendly and also useful for people who want to not go to the default of a bar chart or a picture graph. You're able to see different types of ways that you can visualize data and share that with your audiences. And the last one is data visualization checklist, which is also with Ann K. Emery and Stephanie Evergreen. And they give you a list of things to be mindful of as you start to develop your overall reporting and your presentation slides. Next slide. So do we have any questions before we move on? Catherine Morris mentioned, did you mention how to get slides? Are you referring to Google Slides? Oh, the slides from the presentation. HealthConnect 1 has access to the slides, and we'll make sure that we get them to you after the presentation. All right, so if there's any other questions, we can go ahead and go to the next slide. So what is community organizing? I'm going to also make an assumption that everyone who is with us today has a basic understanding of what community organizing is, but I just wanted to give a definition, the standard definition for community organizing in case people aren't familiar with it. This definition is from Dave Beckwith and Christina Lopez from the Center for Community Change. And community organizing is essentially a process of building power through involving a constituency in identifying problems that they share collectively and the solutions to those problems that they do desire. It identifies the people and structures that can make those solutions possible. It enlists those targets and the effort through negotiation and using confrontational and pressure where needed. And it also builds an institution that is controlled by the constituency that can develop the capacity to take further problems and that embodies the will and the power of that constituency. So community organizing is not merely a process that is good for its own sake. The reason why people do community organizing is because they want to get involved. Something happened that people feel impacted them, and they want to move forward with people who are like-minded to create change. If people join up and there's potential to see a benefit in something, people tend to be more involved if they see that there's an actionable win, as opposed to people getting upset about something and not really doing things about it. There's been a lot of conversations over the past several years as it relates to traditional community organizing, which is people being more out in the field, so to speak, and out on the streets in the community, in addition to how can we use community organizing when it comes to social media? And social media has been a really great way to share what's happening in different communities. So that's something that we can all think about when it comes to developing our projects and how you want to incorporate community organizing into your project. Next slide. So as I mentioned, we are motivated by our own self-interest, and oftentimes people want to organize for change when they know that it not only benefits them, but also benefits the community around them. And so effective community organizing, I feel, can develop a more broader sense of self-interest, and this is where a lot of our hopes come into the picture. How can we broaden a sense of self-interest, not only for ourselves, but also for our communities that we care about? And through a process of building up people, we are able to organize. And we're often taught a lot of times that a lot of these systems that we interact with on a daily basis, because they're so large, that we won't really be able to make any type of impact. And I think even if you do feel that way, people tend to get inspired about what could possibly be. And I think that that is evident in how we perceive a lot of things, particularly when it comes to the United States political system, which I'm not going to go too much into. But when we want change, we find ways to make that happen. And some important examples of that is the Me Too movement, Black Lives Matter movement, Occupy Wall Street, and also the Civil Rights movement. Next slide. So the two main organizing tactics are strategic and tactical. And with strategic power is power that is sufficiently strong to win the issue. And with tactical is power that can move you along toward a goal to help you gain ground, but is not itself divisive. So I would say that a tactical power strategy would be a protest or a rally. You do have a lot of people coming together for a similar cause, but it may or may not impact any type of societal or political change. Next slide. And so in order to develop a strategy, we want to analyze the problem, identify your goals, and also any demands that you want to make. Understand your target, who holds the power to meet your demands, and also identify specific forms of power you have over that target and how to concentrate that power to maximal effort. And within this framework, there's different types of tactics that are specific to different types of activities that you may want to do. You may want to mobilize a specific type and amount of power. You can direct it at a particular target. You can intend and achieve a specific objective. And in choosing the tactic, you may also, or you must always rather, be able to answer the question, what is the power behind this tactic? So in other words, how does the tactic give you leverage over your target? And that is something when it comes to developing our projects specifically, not just the evaluation, that is something to think more about. Who are your target audiences? If policy is involved with your project, what policies are you trying to address that can positively impact the communities that you're working with? Next slide. That was a pretty quick introduction or section on community organizing, but I want to see if anyone has any questions related to community organizing before we go into our last portion, which is going to focus on how we combine the two.
Does anyone have any questions?
We do have one question. Do you recommend a survey before starting a project or hosting a focus group? That would depend on the overall goals and focus of your project. So for example, and I think also in addition to that, it depends on the amount of time that you have for your project. So depending on how you're designing your project, if you are going to be interacting with your participants, for example, like on a weekly basis, you could do a pre-test or post-test evaluation or a survey if you wanted to gather data in that way to compare how people's thoughts and behaviors change over time. If you're doing a one-time training, You may want to do a survey or questionnaire as participants are about to leave the workshop or the training. If you're doing a project where you're interacting with people for an extended period of time, but you're also engaging with them in a very short amount of time. And so, for example, I had a maternal health client a few years ago. It was a collection of organizations based in an urban city in the Northeast, and they provided free doula services to people living in their city. And so the doulas themselves, they were able to go and engage with the expectant moms and their families, but they also, at the same time, as they were engaging with them in that shorter period of time, they had to collect data at the same time. So not only gathering the data for the actual program, but also going back to them in postpartum to get impact and feedback on their interactions with the doula, their interactions with the birthing process, whether it was with the hospital, with the midwife, and also any sort of suggested changes that they could make to the actual doula serving project. So it really depends on the length of time that you have and how often you're able to engage with the program participants. Are there any tools or frameworks that are often used for people of color for evaluating community organizing? I don't know of any specific tools that are geared towards communities of color, but I do want to remind you all of the focus on culturally responsive evaluation techniques. And that is geared towards not just people of color as a culture, but also different types of culture. As you know, culture can encompass a variety of things. That could be race, ethnicity. It could be religion, if you're going into a particular community that has a particular religious viewpoint. That could be age. So for example, if you are doing a project that's geared towards teen parenting, so that culture in and of itself, you're dealing with maternal health, but also dealing with adolescents at the same time. Age is also one. Demographics, where people live, that can also impact how you're doing the evaluation. But what I could do is do some more research to see if there's something specific to evaluating community organizing with a specific emphasis on communities of color. Are you familiar with participatory action research? If so, do you know of some examples that involve people most infected in the data collection process? Off the top of my head, I don't have any specific examples, but I do know just the overall, and we'll get into it in the final section of the presentation, but oftentimes many marginalized communities and also communities of color tend to have a particular view of not only researchers, but evaluators. And sometimes, speaking for myself as an evaluator, we can go into communities and we have a particular level of expertise and expectations of those communities. And we tend to go in and we share our agenda without working collaboratively with the community in order to not only gather data, but also to impact change. And that, I think, is what ties community participatory research also with culturally responsive evaluation. You're working together to build a program on evaluation design. You're working together to do the evaluation, and you're also working together to look at the findings and also share those findings, paying specific attention to the different needs that you have of your audience. That includes accessibility, language, age, and things like that.
Nicole, it was another question before that. And the question said, what do you see are some challenges when evaluating community organizing?
That question is actually going to go into the next presentation. So I'm going to hold that question and we'll just go to the next slide. Does it sound good?
Yep. There is also a comment from, and it says, Nicole is a phenomenal presenter. We are fortunate to have her to present this vital information. This is Suhara Aziz. as a capacity development coordinator with Grow Community, I'm glad we are able to share in this kind of information. So how Nicole expresses means by which communities that are suffering from health and wealth disparities can be able to dismantle that, that which is against its own community self-interests. This is a great example of community organizing with capacity development tools for organizers.
Thank you. Thank you very much. And we have one last comment. What is the difference between community-based participatory research and participatory action research? I would say that they sound very similar, and I don't know the source off the top of my head, but there's a really great source that actually it outlines the major differences between participatory action research, community-based participatory research. And what I can do after the presentation when we send out the slides, Eusebia, is to make sure that I give everyone the link. And I think the link comes from an organization that does a lot of organizing around intimate partner violence. And so I'll make sure that I find that link and I'll share it with you all when we send out the slides. Does it sound good?
Great. Thank you, Nicole.
Okay, so we can go to the next section. So there are, from my perspective, some unique challenges to evaluating community organizing. So to share a little bit more about my background very briefly before we finish up this slide and also finish up the webinar for today. I'm an independent evaluator, but I'm also a licensed social worker. And for those of you that aren't familiar with the social work, the history of the social work profession, it is based on social justice and community organizing. But throughout the years, it's kind of sort of shifted gears towards being more of a clinical aspect of social work. But the focus of social work has always been on community organizing and social justice. And so when I do evaluation for and with my clients, I try to do it from a social justice perspective. With the understanding that, as I said, people tend to look at researchers and evaluators in a particular way because they assume that we are the experts. We're coming in, we know everything about their community, and they don't have any say in it. And so one of the reasons why I enjoy CRE, which is, again, culturally responsible evaluation, and just participatory process in general, it allows for me to be in different types of communities and have them teach me, but at the same time teach them certain evaluation techniques so that eventually they will have the confidence to do all of this on their own. And so some of the unique challenges to evaluating community organizing is that the very bottom-up nature of organizing, it tends to collide with the very top-down nature of traditional evaluation. And what this means is that, as I mentioned, there may be some perceived power dynamics, especially if you are not really local to the community. And there may be some difficulty in navigating between goals of the community versus your funder goals. And I've heard that be an issue with some of my clients in the past where they have particular goals for their project, but their funder wanted something completely different. And so that's something to be aware of as you start to develop your projects, not only within BELA, but if you decide to take this project elsewhere once the BELA project is over. And I think that a community organizing strategy is most effective when it does involve the participants in an ongoing and meaningful way. And it also frames the evaluation, as I said, more as a learning opportunity for everyone, not just for staff or not just for funders. As I mentioned, you're not only learning about them, they're learning about you, and you're learning about everything together. So embracing the bottom-up approach to organizing and organizers' democratic notion of expertise, that tends to land an evaluation that leverages the strengths of organizing rather than finding the values of organizing, if that makes sense. And so it's a stark contrast to accountability focused analysis, So as such, a more participatory approach, I feel, is a more effective way to capture useful and reliable data. Next slide. So bringing this all together, community organizing evaluation is more participatory versus being standoffish and third party. It's more prospective rather being solely retrospective. And what I mean by that is that prospective, it allows for you to be focused on the here and now and be able to take action versus just solely just seeing what the results are and not doing anything with them. It's very learning based, and it's also very real time, depending on the type of evaluation that you want to do and the amount of time that you have, you can course correct along the way. And it also respects the history and culture of community organizing, and it focuses on leadership development of those communities. And that goes back into the evaluation theories that I mentioned before, which is culturally responsive evaluation, participatory evaluation, utilization focused evaluation, and empowerment evaluation. And so before we go into any additional Q&As, I wanted to share a case study from one of my past evaluation projects that focused on not only evaluation, but also on community organizing. And so I worked on a project with the New York City Department of Health and Mental Hygiene, and it's a 5-year initiative that is advancing sexual and reproductive justice in New York City. And so out of that became the Sexual and Reproductive Justice Community Engagement Group, and that is a collection of community leaders, activists, and nonprofit organizations that work with the Department of Health. This group meets on a monthly basis to plan and implement activities that encourage all New Yorkers to safely express their sexuality and gender identity with dignity. And this group works to ensure everyone has the knowledge, skills, and resources to lead healthy and fulfilling lives. And for more information on that, you can do a Google search for SRJ CEG, and it comes into the first results. But I want to kind of outline some of the things that I did with them. I worked for them for 2 years, first as an the second time as an evaluation consultant, but in the first year as a reproductive justice consultant. In the first year, we met with various stakeholders to share the plan of the 5-year initiative to promote sexual and reproductive justice in New York City. And out of that was the creation of the Community Engagement Group. And it comprises of organizations and individuals from all 5 New York City boroughs that are coming together, not only just for reproductive health, rights, and justice, but also more intersectional work such as substance use, criminal justice, working with different languages and things like that. And in the second year as an evaluation consultant, I worked with the Department of Health to facilitate community gatherings and develop an evaluation process with that. And so we went to various organizations throughout the 5 boroughs to gather some insights on what barriers that the communities were facing in advancing sexual and reproductive health, rights, and justice in New York City. And out of that came some emerging themes from the community gatherings that informed the CEG to develop a community organizing campaign. There were a variety of organizations. Some worked with youth, some worked with individuals who were over the age of 55. Some were organizations that supported and hired doulas. Some worked directly with young people. And so we had different types of emerging themes and perspectives, not only as related to those individual communities, but also collectively. And there were different, I believe there were several topics that came out that piqued the interest of the CEG. And one of them was focusing on birth justice. And so maternal health rights and birth equity was chosen as their campaign for the final 3 years of their campaign. I think right now they're getting into the final year of the 5-year initiative, where they're talking about and discussing how to advance the work after the 5-year initiative is over. Next slide.
Before we go to the next slide, there are some questions in the chat box.
Okay.
If the CHW's community health workers did have an active roles as researchers, it's a comment, right?
Oh, it's a comment. Okay. And also, Yvette, we're going to be sharing the recording and the slides after the presentation. And that's also for Teresa. Okay, I think we can go on to the next slide.
Carmen Mojica, she commented, I used to be in CEG.
Oh, great. I think we have a lot of, I think we may have a few members who are a part of BELA that also are within the CEG, not only as participants, but they also have helped to strategize and develop the community organizing campaign as relates to birth equity in New York City. So I'm happy to see that there are some people on the webinar today who are a part of or used to be a part of the CEG. So as we move forward, I wanted to share some questions, particularly for those of you who are doing the community demonstration projects. How can my project and the evaluation process help me to collaborate with my project recipients and alongside other stakeholders? How can my project and evaluation process help me to better capture and tell the stories of my community? And also, how can this project and the evaluation process help me to continue my project after BELA is over? For those of you who are being formally introduced to HealthConnect 1, the BELA project actually ends at the end of 2019. The community demonstration projects end a little bit before that, but the overall BELA project actually ends in 2019. So the Birth Equity Leadership Academy, which the demonstration project awardees came from, is considered an activity of the BELA project. And so you all are helping us to shape some future programmatic work for HealthConnect 1. And hopefully the ideal is that when you're done with your demonstration project, that you continue to work on those projects after BELA is over. And also this is something for the HealthConnect 1 staff as well. Once BELA is over, what have they learned about the process? And if so, what can they do to implement this process and to move the work forward? So as I mentioned with evaluation, it's an ongoing process. You never just stop at one thing. Sometimes it inspires you to investigate something completely different, particularly if you expected for your program to be engaged in a particular way, but your participants give you insights on how they're engaging with the project, and it may give you some curiosity to continue to move your projects forward. So I hope that this presentation, I was trying to move it as quickly as possible, but I hope that you all were able to get some information that can help you as you start to do your evaluations and develop your projects. And also I can make myself available, particularly to those of you who are doing your community demonstration projects. If you have any questions about the evaluation process or how you're developing your projects, I can work with Sadie and Brenda to best address any concerns or just some general questions that you may have along the way. Next slide. And so with that, I'm going to open up the floor for some questions. But before we do that, I wanted to share some questions that came to us by way of some of the community demonstration project awardees. And so I want to address them now. And I think I may have touched on some of them during the presentation, but I just want to share them again. What information should a project evaluation include? Is it more like a report or like an outline? So the evaluation process does have a reporting mechanism, and that could be developing a report after the project is done. Your outline will be more specific to your actual project. And so you'll be sharing with Brenda your overall goals for your project and the different types of activities when you're planning on doing those activities. But overall, those things will come together and help you to not only do the evaluation activities, but also to help you to be able to effectively report back to HealthConnect One. Again, evaluation reports tends to be the standard for a lot of funders. And so I would defer to Brenda on how best she wants you all to report back your findings from your evaluation of your project. And both Sadie and I will be working with Brenda to discuss some different ways to help you all with the reporting process. And also, again, any other type of questions that you may have along the way with your project. The second question is, are there any criteria or specifications regarding the types of forms of evaluations we plan to use? Again, Sadie and I can work with Brenda to determine if there's going to be a standard evaluation form that you all will be using for your demonstration projects, or if you all have free reign to develop the types of forms that you may need for the project. I, again, can make myself available if you have any questions on how to develop a survey. If you have any questions about how to develop some focus group questions or some key informant interview questions, we can work together to fine-tune your goals of your project and make sure that whatever activities that you're going to be doing as it relates to evaluation aligns with the goals of your project. And the last question is, are there any specific questions I should add to our evaluation questionnaire for clients when we talk about measuring results? How exactly do we measure outcomes? The questions that you're going to be asking of your clients in this case will be dependent on the overall goals of your project. So once you're able to identify what those goals are, you'll be able to identify what questions that you want to ask. Typically, some standard questions are demographics. If you feel it's important to identify the demographics of the individuals who are engaging with your program or your project. And also questions that are outlining specific things as far as the learning objectives for your project. So if you had different types of learning objectives, you can ask questions based on those learning objectives to see, based on that, how participants were engaging with your program or your project. Do we have any other questions? Oh, the last part was when we talk about measuring results, how exactly do we measure outcomes? You measure your results and outcomes based on the overall goals of your project. Ideally, you would want to be identifying what would be a metric of success for you. You can work with HealthConnect One to determine what those metrics could be. But if you are creating a project for BELA and you have your own ideas of what success is. So a lot of times success could be determined by your funder. But I also encourage my clients to identify what their own metrics of success were. With those metrics also include, a lot of funders, they like to know numbers. They want to know how many people engaged with your project. If you had an event, how many people showed up? If you had a call to action to get people to sign something, how many people signed it? And so those numbers tend to be really important to funders, but also making sure that you determine what your own metric of success is. If you wanted to have participants reach back out to you later on and tell you how, by participating or engaging with your project, how it impacted them and how they were able to take what they've learned from your project to other people in their community, that can be considered a success as well. So how many people reported back to you on what they did? One of the surveys that we have with HealthConnect One and the BELA project is, a question rather is, what is one or two things from this regional meeting or from this BELA retreat? What is one thing that you're taking from today to your community? And that's a good way to determine what really resonated with your participants. And that also helps if you see that participants are saying the same thing, and you can see that that can be an emerging goal or an emerging theme as well, and it comes to your data. And that's definitely something to highlight when it comes to reporting in your evaluation. Well, we do have some questions. Can we receive assistance if we didn't receive the project award? I was awarded a local grant. Were you awarded a local grant through HealthConnect 1 or through some other means? Oh, through my city, but I'm a BELA leader. I don't see why I couldn't assist you independently of the BELA project. Actually, we do have an evaluation committee, and it consists of 3 individuals who aren't a part of BELA, but the majority of the members are a part of BELA. And we can use them to be an overall resource, not only for the people who are doing the community demonstration projects, but just overall for everyone who is a part of BELA. So if you do have any questions as it relates to BELA in general, or anything specific to the activities that are involved with BELA, you can contact me. I can put my email in the chat. And if it's something that I can respond to, I'll definitely do that. But if it's something that I think that it will be beneficial to get some additional insights from the evaluation committee, I can share your question with them and we can get back to you. Do we have any other questions?
There's a comment from Desiree.
Oh, I'm a fan for your insight. I'm also a social worker. Thank you so much. I always like to connect with different social workers, particularly social workers that tend to do a lot of community organizing work. So, and also Desiree, Brenda wants you to also reach out to her as it relates to your project. Do we have any other? No, I don't think we have any other questions. So again, thank you all for coming today. We'll make sure that we send you all the recording of today's webinar and also the resources that I mentioned. And also I'm gonna make sure that I send you all some additional links as it relates to evaluation. I created a list that I've shared with all of my evaluation clients on different common evaluation terms. So I'll send that to you all. I'm going to send you some information on developing logic models for your presentation or for your project, which is something I realized that I didn't really touch on in the presentation. I'll send some videos on the differences between developing a logic model versus developing a theory of change. And I'll also send you some templates that I've been using with HealthConnect 1 as relates to helping them to build their logic model for the BELA project. Helping them to build their evaluation framework and also helping them to develop their data dissemination plan. And what that is helping you to identify how you're going to share your information and who you're going to share it with and how often or how frequent you're going to share that information. So I'll make sure that HealthConnect 1 sends you all these additional resources along with the webinar recording and the PowerPoint slides.
There is another question. Can we open or can you open a phone line for questions?
Is there a phone line?
Yes.
Oh, okay. Are people able to call in now, Eusebia?
Yes, the people are able to call in now.
Okay.
There is another comment from Jennifer Canton. Thank you. This was informative. Jennifer Canton, a doula from Brooklyn.
Thank you, Jennifer. It sounds like the line, Eusebia, it may be muted. Eusebia, it says only the host can unmute the line, so I think you may have the controls on your end.
Okay, just a moment.
Okay. Oh, the question is, will HealthConnect 1 be evaluating the BELA projects? As I mentioned, the community demonstration projects is one of the overall activities for the BELA project. And so what we'll be doing on our end for the evaluation is we'll be looking through the reporting for each community demonstration project and sharing those results and how they tie into the overall goals of the project. So they won't be specifically like looking directly at your project to determine what went well and what didn't went well. Is more so a learning process for particularly how HealthConnect 1 can continue to engage with community organizations and community members, because HealthConnect 1 does do a lot of work nationally with different types of individuals and communities. And so what you all are doing as part of the demonstration projects is helping HealthConnect 1 to, if they need to course correct, as I mentioned during the webinar, but also to see what they're doing is just as impactful as what you all are doing within your communities. So essentially you're giving them additional data. And then later on in the project, which will be in 2019, there's going to be an additional project outside of the community demonstration projects where we'll be doing the same type of project, but it's going to be geared towards certain communities that HealthConnect 1 has relationships with. So if you didn't get the demonstration project award this time around, it is possible that you may get it the next time around, particularly if you resubmit your proposal, and especially if you're in those particular areas. But HealthConnect 1 will let you all know which areas those are towards the end of this year and in the beginning of 2019. And Sadie says, HC1 and Nicole will be working with the BELA project community awardees to help them evaluate their projects.
Is there any questions? We are having issues with the audio. We apologize for that. If you have any questions, please write them in Q&A or in the chat box.
Thank you, Sadie. Sadie says, thank you everyone for asking such thoughtful questions, and thank you, Nicole, for an informative presentation. And Tanya Davis says, this was great information. Thank you, Nicole. I mean, if I find any additional information, particularly connecting evaluation to community organizing, I'll be sure to share that information also with Brenda, so that she can share that not only with the people who are doing the projects, but with BELA overall, so that whether you're doing a demonstration project or not, you'll still be able to have that information.
There is another question, Nicole.
Yes, so Desiree says, how can one integrate mental health with a reproductive justice framework? So what you're speaking to is intersectional analysis. And so what that is understanding that there's different aspects of people's lives that impact how they access different types of reproductive health information and services. And mental health is one of them. Including mental health, there can also be substance use. Age may play a factor in how people access different types of services. Language barriers sometimes, different things like transportation, people who may be involved in the criminal justice system. So there's a variety of things that could be impacting how we are able to access and achieve reproductive justice. And I can also share a document that I created a while back for another client that outlines the difference between the different frameworks. So that's reproductive health, rights, and justice. I can share that also with you all when we send out the information. And if I find particularly any organizations that connect RJ to mental health, I can share that with you all also. Mm-hmm.
There is another question.
For the projects that are very complex, will HealthConnect One help in connecting leaders with the institutions that can provide policy change? That's a question for Brenda, I would say, because HealthConnect One is committed to assisting you all, not only monetarily, but also technical support. I'm not sure if that's connected to technical support, but for your specific question, if HealthConnect One has a process or community member that can better connect you as it relates to the community members that are in your area, I think that HealthConnect One should be able to help you out with that.
There was another question before that, Nicole.
Yeah. Oh, and Sadie says, we'll be happy to have a discussion with you about your needs and how we might be able to assist. Another comment was, a common theme of conflicting agendas seems to arise in many intersectionality focused programs. How do we navigate to support communities that are oftentimes discounted as a priority when the community that we are representing is directly concerned with its needs being represented better rather than all, which is oftentimes used to exclude protections for certain groups who pave the way for others? Example, multi-generational Black families of America, Black religious groups members. That's a very complex question. I will have to think a little bit more about that. But yeah, different types of communities have different things that do impact them. So for example, if someone is Latina and a part of the LGBTQ community, there's different communities that they're a part of. And so how they're impacted within the Latino community can be different how they are impacted by the LGBTQ community. And so you're identifying the different communities that are a part of you. And sometimes those different communities can be more oppressive than others. And so there is a lot to do when it comes to intersectional work, particularly when it comes to birth equity work. You're trying to understand the unique needs of different individuals and communities, while at the same time trying to help advance birth justice and birth equity in your community. Oh, and Brenda said HealthConnect One will provide support to leaders throughout their projects.
We have two more minutes for any other question or comment that you might have.
Desiree has more questions, but she'll email me. Okay. I do want to reiterate before we get off the line today that evaluation is really a learning tool. I know that it can be very overwhelming and intimidating a lot of the time because we often feel that we don't have the skills or the tools necessary to conduct an evaluation. But I think a lot of it comes to not only knowing that there are some affordable and low cost evaluation tools that we can do, but we do have the ability and the confidence to do evaluation work. And so I do enjoy working with clients who want to build those skills, because I do feel that evaluation is a good tool to have, whether or not you're working with data. If you don't work directly with data, but you're interacting with someone who does, they can help you into learning that different types of tools, because that can always be something that you can learn and take in any future endeavor. And so particularly when it comes to birth equity work, you want to know if what you're doing is effective and how impactful it is in your community. And the only way that you can really do that is get feedback from your community, and also work with the community to not only to make sure that the program is being operated the way that it's intended, and also being accountable to the community to share your results. So we're at 1 minute till. If no one has any other questions, thank you all for joining us today. If you have any additional questions, feel free to email me at contact@NicoleClarkConsulting.com. And you can also email Brenda and Sadie as well with any HealthConnect One related questions.
We have two more comments before we leave.
Yes.
And it's from, go ahead, Rosalie.
BELA has services for everyone interested in birth equity, including BELA leaders and faculty. We appreciate all the work that you are doing. Thank you for this wealth of information. You're welcome. Thank you, thank you. And also Sadie put her email and also Brenda's email for you all to connect with them as well.
Okay, great. Thank you everyone for taking the time to be with us, especially thank you, Nicole. That was a wonderful presentation. I learned a lot, and I'm sure everyone learned and enjoyed your presentation. Thank you so much for your time. Thank you, and thank you. Have a great day.
I think we may be cutting off, but thanks everyone for sticking around with us as we answer some questions.